I want to start with the big news that broke yesterday that Governor Abbott has a breakthrough case of COVID-19. He is fully vaccinated. What was your reaction to hearing that news?
Well, three things. Number one is I hope that the governor does well, that he stays healthy. Number two, I would point out that, if you're going to behave like the governor has been behaving, and that is to be not wearing a mask and to be in crowded settings, you're going to get exposed to the virus. And even if you're vaccinated, if you put yourself in situations where there's lots of virus around, your chance of becoming infected is really pretty high. Remember, the vaccine is very protective, but it's not 100%. And its best impact is keeping you from becoming hospitalized or dying. It doesn't mean that you won't necessarily become infected and get sick. So it's not 100%, but it's highly effective. And I think that what we take away from the governor is that if you put yourself in those situations, you're going to be exposed. You may contract the virus. If you've been vaccinated, you're going to do a whole lot better than if you're not vaccinated. And I really wish the governor well, and I hope that he stays healthy.
One of the things that his office announced was that he's getting Regeneron's monoclonal antibody treatment. Is that a treatment you would recommend for other breakthrough patients?
So there are criteria for who gets the Regeneron and who gets the monoclonal antibodies, and they're fairly liberal, and they generally work much better the earlier on in someone's illness. Now, I'm not the governor's doctor, so I won't speak to whether or not he met the specific criteria for it. I will assume that he did. But in general, the monoclonal antibodies, when given to the right patients and given early, are highly effective. We're getting really very satisfactory results from the monoclonal antibody therapy. And you're seeing that there are infusion centers being set up across the state. In fact, the state itself is helping to support some of these so that we can get the monoclonal antibodies out into the community much more readily than we've been able to with traditional methods. So in any community, there are infusion centers, and they're generally used for chemotherapy patients, but they're full. They've got chemotherapy patients filling up their schedule anymore. So I'm glad that the state and the federal government are supporting making that a more robust network of ways for people to get the monoclonal antibodies.